Good afternoon ulit. Good afternoon, Doc. Good afternoon po sa lahat. Now we go to the long tongues, heart blood deficiency. Okay, first, we have a case of a female, 32 years old. The tongue description is slightly pale, so there's a presence of slight spleen deficiency or blood deficiency. The tongue is long, so there's a constitutional weakness of the heart. There's also presence of vertical crack in the center with rootless coating. So there's a stomach yin deficiency, onset of kidney yin deficiency. Patient symptoms is inability to relax, inner tension, headache with tight neck muscles, pain and weakness of the lumbar area. There's a occasional numbness and tingling of the right arm. Presence of insomnia and fatigue. So Western diagnosis, there is neck pain, primary infertility. Sa background to disease, overwork, perfectionist attitude. Okay. Sa case history, Mrs. H is a 32 years old, runs her own architectural business. She describes herself as a perfectionist. She is thus very critical of herself and the people around her, causing her to experience constant inner tension. At the same time, she is always worried about not being successful. She connects this fear to a feeling of tension around the neck and shoulders. She works more than 60 hours a week. The lack of spare time means she eats irregularly. She also drinks a lot of coffee and sleeps very little. The physical symptoms of which she complains are headaches and tension around the shoulder and neck. She is also extremely worried about her infertility. The tongue is noticeably long and shows a rootless coating. Her pulse is slightly rapid and choppy. Sa analysis, for constitutional reasons, her emotional reaction gave rise to heat in the heart as manifested in the red points at the tip of the tongue and the slightly rapid pulse. Because the discoloration of the red points at the tip is not very severe, the heat in the heart appears to be of recent origin, possibly related to starting her own business. However, the long tongue body reflects a constitutional tendency towards the development of heat in the heart. Stress, a hectic lifestyle, and inner tension led more readily to the formation of heat in those with this tendency than would be in individual with other types of constitution. The patient's irregular eating habits and excessive consumption of coffee has endured her postnatal chi, which in the long run will lead to malnourishment of kidney yin and essence. The onset of this pathology is reflected in the rootless coating on the posterior third of the tongue, as well as the soreness in her lower back. The vertical crack in the midline of the tongue indicates a slight deficiency of stomach yin. Although the pale tongue and the choppy pulse denote blood deficiency, the pathology of patient also points to the onset of heart and kidney yin deficiency. The sleeping problems, restlessness, and functional infertility point to blood as well as yin deficiency. The occasional headaches and the tingling and numbness are related to liver blood deficiency. The treatment consisted of harmonizing the communication between the heart and kidney and strengthening the blood and kidney yin. The Tai Chi Yuan, acupuncture, and herbs help all the symptoms, including the infertility. 2 years later, she gave birth to a healthy baby. Sa discussion, the long tongue reflects disharmony between the fire, the heart, and the water, which is the kidney, which may in some cases be a constitutional origin. This disharmony may give rise to symptoms like restlessness and sleeping disorders that go hand in hand with deep-seated fears and long-lasting exhaustion. We have a case here of a female 42 years old. The tongue is reddish, long, and narrow. So there's presence of heat with injury to the fluids, constitutional heat in the heart. It is also there's also a slightly yellow thick greasy coating. So there's accumulation of damp phlegm in the stomach. Patient symptoms is stomach pain with stress, epigastric fullness, lack of appetite, depression, and fatigue. So Western diagnosis, there is a polyps in the stomach. Sa background to disease, overwork, emotional problems due to death of mother, and divorce in the same year. Okay. Next case is a female 38 years old. The patient tongue is red, very narrow, and contracted. So there is a severe exhaustion of kidney yin and essence. The long firm tongue body indicates that there is lack of blood body fluid. There's also a slightly deviated tongue, so there is an onset of internal wind. There is a red tip, so there is heat in the heart. There's also a midline crack over the entire tongue body. So there's a constitutional weakness of the heart. Also an old yellow coating. So there's injury to body fluid due to heat from excess. Patient symptoms is atrophy and pain of facial muscles. There's a complete loss of all body and head hair. There's also a facial eczema, exhaustion, insomnia, unwanted weight loss. So Western diagnosis, there's a typical progressive collagen vascular disease. As a background to disease, there is a weak constitution, night work for many years, chronic lack of sleep, irregular eating habits, tea and coffee abuse, overwork, and excessive use of willpower. Next, we go to the tongue signs associated with heart blood deficiency. Blood deficiency in the body will reduce the supply of blood to the tongue, which will thereupon become pale and dry. There are three visible manifestations of this pathology on the tongue. First, the tip of the normal tongue is red and shows many red small points, while the tongue body is pale or pale red. A slight reddening of the tip is likewise normal and important as it reflects good communication between the gate of vitality, the ming and the heart. The physiological fire of the gate of vitality causes this slight redness in the tip of the tongue. However, a strong red discoloration of the tip points to the presence of heat in the heart. The degree of redness indicates the strength of the heat, which will also manifest in corresponding symptoms. Second, a pale or pale red tongue with curled down tip indicates heat from deficiency of the heart. When accompanied by a pale tongue body, there will be a tendency towards depressive mood. Third, the pale tongue that shows contracted or indented tip also reflect a heart blood deficiency with a tendency towards heart deficiency. Okay, so meron siyang indented tip. These signs might be said to reflect a lack of substance with which to fill out the tip of the tongue, thus depriving it of its normal shape. A different pathology is involved in the long, very pointed tip. In that case, it is heat which endures the blood yin and the fluids, depriving the tip of substance. The presence of heat or fire in the heart is much stronger and more vigorous than in the situations described above, and the results in the extreme protuberance of the tongue, quite the opposite of what is observed with pale and dry tongues. Okay, the tip of the tongue in those who have suffered for a long time from unstable emotions like depression is often contracted. Although no reference to this tongue shape could be found in the literature, there may be another way of interpreting it. So, a contracted tip may indicate a dysfunction of the womb. It is a function of the penetrating vessel to send heart qi and blood to the womb. When this internal vessel is free of any blockage, menstrual blood will flow freely and the heart can communicate freely with the womb. Because of this connection between the heart and the womb, deficiency of heart blood is deduced from a contracted tongue tip may lead to malnourishment of the womb. The contracted tongue tip may also indicate a blockage of the penetrating vessel, which will interfere with the smooth flow of the heart blood to the womb. I often, sabi niya, interpreted the tongue sign, especially when it is accompanied by a distended, swollen, and blue sublingual veins, to mean possible stasis of blood in the womb. The patient presenting with these tongue signs frequently have menstrual problems, especially pain and uterine fibroids. So we go to the next case, female 38 years old. The tongue is pale, swollen, with slight teeth marks. So there's a presence of spleen-chi deficiency, accumulation of dampness, and deficiency of blood. There's also indentation of the tip, which indicates a heart blood deficiency. Also, presence of white thin coating, which is normal. Patient symptoms is headache for the past 20 years, especially during menstruation, nausea in the morning, lack of concentration, and fatigue. Sa Western diagnosis, there is a hypothyroidism. Sa background to disease, family history of headache, long-standing emotional problems, and excessive anxiety. Next case is a female, 46 years old. The tongue is pale red and swollen, so there's a presence of spleen-chi deficiency, accumulation of dampness. There's also a slight reddening of the tip, so there's heat from deficiency of the heart, and presence of indentation of the tip, which is a heart blood deficiency. Patient symptoms is inability to fall asleep, fatigue, painful menstruation, prolonged bleeding, depressive moods. So Western diagnosis, there is a uterine fibroid. The background to disease worries a great deal, emotional problems due to difficult personal relationship, and to abortions. Sa case history, during a routine medical examination, a uterine fibroid was found in this 46-year-old journalist. In addition, her menstruation had changed in the last 6 months. The patient had noticed spotting before and after the period, as well as stronger menstrual bleeding. Occasionally, she felt pain and pressure in her lower abdomen. She had several difficult emotional relationships, and because of this, felt very unsure of herself. She had a tendency to suffer from depression and was restless and discontented. The tongue body color was normal, its shape was slightly swollen, and the tip was indented. The sublingual veins were slightly distended, her pulse was deficient and slightly slippery. Sa analysis, the constant anxiety, pensiveness, and self-analyzing resulting from a painful relationship weakened the spleen-chi and heart blood of this patient. The difficulty in falling asleep and the depressive moods were related to these deficiencies. The fibroid was the result of stasis of blood in the womb. In addition, her 2 abortions at 30 and 35 years of age may have contributed to injuring the penetrating vessel. This vessel controls the blood flow to the womb. It thus prevents stasis and regulates the menstrual cycle. Because the penetrating vessel was blocked, there was painful menstruation as well as long-standing spotting. The chi and blood deficiency led to blood stasis as the blood was not sufficiently moved. Moreover, the weakened spleen chi did not produce enough blood, which affected not only the heart blood, but also gave rise over time to blood stasis in the womb. The deficient slippery pulse confirms this diagnosis. The contracted tip in this case reflected the failure of the heart blood to flow freely to the womb and a blockage of the penetrating vessels. So we go to the next case, female, 28 years old. The tongue is pale red and soft, so there's a presence of spleen-chi deficiency. There's also indentation of the tip, which is heart blood deficiency. There's also swollen in the anterior third, so possible heart chi deficiency. There's a yellow thin coating with red points at the root. So there's a heat in the lower burner. Patient symptoms is long-lasting profuse menstrual bleeding, lower abdominal pain during menstruation, and sa Western diagnosis, there is menorrhagia, infertility. Sa background to disease, long-standing emotional problems. Next case is a female 40 years old. So, ang tongue na patient is pale, slightly swollen. So, there's a presence of spleen chi deficiency, accumulation of dampness. So, a curled down teeth with red points. So, there's a heat from deficiency of the heart. Patient insomnia, exhaustion, moods. There's a cough and shortness of breath. Sa Western diagnosis, there is none. Unwanted divorce, overwork, her first child. Next patient is a male, 57 years old. The tongue is pale, slightly swollen. So there's a presence of spleen and lung chi deficiency, accumulation of dampness. The tongue is also slightly indented at the tip, so there's a heart blood deficiency, and there's a depression at the root, so there is a deficiency of essence, and presence of yellow thick coating, so there's a retention of damp heat in the lower burner. Patient symptoms is depression, despondency, crying spells, fatigue, and lack of appetite, loss of weight. There's none sa Western diagnosis, and sa background of the disease, difficult divorce, physical and mental exhaustion. Sa case history after his divorce, the 57-year-old Mr. G began a new life, going back to school and buying himself a house that he then renovated. Strong depressive moods then set in, characterized by crying spells, feeling of hopelessness, a lack of drive, and suicidal thoughts. He was very tired, lost his appetite, and suffered weight loss. His tongue was pale and showed an indented tip and depression at the root. His pulse was very frail and submerged. Sa analysis in this case, the combination of deficiency of essence, spleen chi, and heart blood resulted in weakness of essence and spirit. The changes in his life caused Mr. G to throw himself into all sorts of activities to compensate for the emptiness he felt, thereby abusing his energetic resources. His essence, which at the age of 57 should be preserved by contemplation and a quiet lifestyle, was thereby weakened, which was manifested in his reduced vitality. The frail pulse and the depression at the root of the tongue confirmed this diagnosis. The simultaneous physical exhaustion caused by the renovation of his house led to a deficiency of spleen and lung chi. Blood is produced in the heart, and the essence from food distilled by the spleen chi and essential to this process. These essence are transformed into blood in the heart with the help of the source chi. Spleen chi deficiency can therefore readily lead to heart blood deficiency, which in this case is reflected in the indented tip of the tongue. The discussion in general, it can be said that spleen chi deficiency not only causes an accumulation of dampness, but also contributes to the heart blood deficiency. This is especially common when the patient suffers from excessive mental and physical strain. The indentation at the tip of the tongue is an important indication of spleen chi and heart blood deficiency. Next, we go to the female, another case of female 28 years old. The tongue is pale and swollen. So there's a spleen chi deficiency, accumulation of dampness. There's also a swollen center of the tongue. So retention of turbid phlegm in the stomach. There is an indentation of the tip, so there's heart blood deficiency. Slightly raised red points at the tip, so there is an acute externally contracted wind heat. Patient symptoms is itchy eyes, runny nose, headache with change of weather, fatigue, occasional depressive moods. So Western diagnosis, there is allergic rhinitis, and sa background to disease, severe mental demands at work, irregular eating habits. Next case is a female, 63 years old. The tongue is pale and swollen. So there's a ciency deficiency, accumulation of dampness. Tongue is also dry. So there's lack of fluid in the stomach. There's also a small deep cracks in the center and anterior third. So there's an onset of stomach and lung deficiency and a deep crack in the tip of the tongue. So there's a heart G and yin deficiency. Patient symptom is severe exhaustion, shortness of breath, inner tension. So Western diagnosis, non-Hodgkin's, lymphoma, right heart insufficiency. Sa background to disease condition after chemotherapy, radiation therapy, and splenectomy. Okay?